Mpox, formerly recognized as monkeypox, has transitioned from being a regional issue confined to parts of Central and West Africa to a growing global concern. This viral infection, caused by the monkeypox virus, shares similarities with smallpox but is typically less severe. Recent outbreaks in non-endemic areas have highlighted the need for international cooperation and robust public health strategies to address its spread effectively. Mpox is a zoonotic infection, meaning it can be transmitted between animals and humans. The monkeypox virus belongs to the orthopoxvirus genus, which includes the variola virus responsible for smallpox. Though Mpox has been historically less threatening, its ability to infect both humans and animals poses unique challenges. The disease primarily affects individuals who come into close contact with infected animals or humans, emphasizing the importance of understanding its transmission pathways. The virus spreads through two main routes, animal-to-human and human-to-human contact. Animal-to-human transmission occurs through direct interaction with infected wildlife, including rodents and primates. Contact with animal bodily fluids, blood, or lesions increases the risk. Human activities such as hunting or handling bush meat in endemic regions amplify exposure. Human-to-human transmission requires close interaction. Prolonged exposure to respiratory droplets is a primary method of spread, alongside direct contact with bodily fluids or lesions. Contaminated materials, such as bedding or clothing, can also carry the virus, allowing indirect transmission. The virus's resilience on surfaces makes it challenging to contain, particularly in healthcare or shared living environments. Mpox manifests through a combination of flu-like symptoms and a characteristic rash. The disease begins with an incubation period that ranges from 5 to 21 days, followed by two distinct phases. The early phase involves fever, headache, muscle pain, backaches, swollen lymph nodes, chills, and fatigue. Swollen lymph nodes are a hallmark sign, distinguishing Mpox from smallpox. The rash typically appears a few days after fever onset. It begins on the face and spreads to other areas, including the palms, soles, and mucous membranes. The rash progresses through stages, starting as flat spots before evolving into raised lesions, fluid-filled blisters, pus-filled sores, and finally scabs. While most cases resolve within weeks, severe outcomes, including complications like secondary infections or respiratory issues, can occur, particularly in vulnerable groups such as immunocompromised individuals, children, and pregnant women. There is no definitive cure for Mpox. Treatment focuses on alleviating symptoms and managing complications. Supportive care, including hydration, pain management, and treatment of secondary infections, plays a crucial role in recovery. In some cases, antiviral drugs such as tecovirimat have been used under compassionate protocols. Developed for smallpox, this medication has shown promise in reducing the severity and duration of Mpox. The success of these treatments depends on early detection and access to healthcare resources. Vaccination offers an additional layer of defense. Vaccines originally designed for smallpox have demonstrated cross-protection due to the genetic similarities between the two viruses. These vaccines are often recommended for healthcare workers and individuals at high risk of exposure, especially during outbreaks. Preventing the spread of Mpox requires a combination of public awareness, hygiene practices, and proactive healthcare policies. Avoiding direct contact with wildlife that may carry the virus is critical, particularly in regions where Mpox is endemic. This includes refraining from handling or consuming bushmeat. Proper hygiene, including regular handwashing and the use of protective equipment when handling animals, reduces the likelihood of exposure. Vaccination campaigns targeted at high-risk populations and healthcare workers have proven effective in curbing outbreaks. Isolating infected individuals and identifying their close contacts through thorough tracing efforts further limit transmission. Education plays a vital role in prevention. Public health campaigns can inform communities about symptoms, transmission risks, and protective measures. By reducing misinformation and stigma, these efforts encourage individuals to seek timely medical care and adhere to safety protocols. Although Mpox was historically confined to certain regions in Africa, the disease has increasingly been reported in countries far beyond its traditional range. Factors such as international travel, global trade, and ecological disruptions contribute to its spread. The movement of wildlife, coupled with environmental changes that alter habitats, creates new opportunities for zoonotic diseases to emerge. The global nature of recent outbreaks underscores the importance of surveillance systems capable of detecting cases early. Strengthening these systems involves training healthcare professionals, enhancing laboratory capacities, and fostering international collaboration. The role of organizations dedicated to global health cannot be overstated, as their coordination efforts provide vital resources and knowledge-sharing opportunities. The recent resurgence of Mpox highlights the interconnectedness of human, animal, and environmental health. Addressing such diseases requires a comprehensive approach that integrates medical advancements with strategies to reduce risks at the source. Strengthening health infrastructure, particularly in resource-limited settings, is essential. Investments in diagnostic tools, treatment options, and vaccine accessibility can reduce the impact of future outbreaks. Research into antiviral therapies and next-generation vaccines remains a priority, with collaborative efforts between governments, researchers, and the private sector holding the potential to accelerate progress. Raising public awareness about zoonotic diseases and their prevention can empower communities to adopt safer practices. Education initiatives that focus on hygiene, responsible interaction with wildlife, and the importance of vaccination can significantly reduce disease transmission. Global health challenges like Mpox also emphasize the need to address broader environmental and societal factors. Deforestation, urbanization, and climate change contribute to disruptions in ecosystems, increasing human-wildlife interactions and the likelihood of zoonotic spillover. Sustainable practices that protect biodiversity and mitigate environmental degradation play a critical role in preventing such events. Mpox serves as a reminder of the fragile balance between human health and the natural world. While it may not match the severity of smallpox, its capacity to spread across borders and affect vulnerable populations cannot be underestimated. By combining scientific innovation with public health measures and addressing the root causes of zoonotic diseases, the global community can better prepare for and respond to such threats. Through vigilance, collaboration, and a commitment to sustainable health systems, the impact of Mpox can be mitigated, ensuring a safer future for all. And that's everything you need to know about Mpox, how it spreads, the symptoms, and what we can do to protect ourselves and our communities. Remember, awareness and prevention are key in tackling global health challenges like this. Stay informed, stay safe, and let's work together to build a healthier future. Don't forget to like, share, and subscribe for more updates and insights on health and wellness. Thanks for watching, and see you next time.